Let's take a look at the global picture. What is happening around the world? Well, Germany is one of the areas of focus for us. Indeed, Europe has been. We've taken a look at what's happening in Italy and the pressure that health officials and health system has come under as far as dealing with coronavirus is concerned. I'm going to take you to Europe now. We're going straight to Germany, where Thomas Sparrow, a political correspondent with our partners DW, is standing by to give us a briefing on the European situation. Thomas, it's good to have you once again. Thank you. Well, Thomas, I'm just going to go straight to ask you.
Nice to be with you, Gifty.
Right. Right. So I'm just going to go ahead and ask you about what the latest is. Looking at Europe, Italy, Germany, what's the latest update?
Well, one of the latest developments here, Gifty, is that the current restrictions that are underway, that were imposed by the government a few days ago, those restrictions that we spoke about on the program, and which involve people being asked to stay at home and meetings of more than 2 people being banned, so people are supposed to stay at home, although that those measures are not compulsory. People can still go to work if they desperately need to, but those measures have been extended beyond Easter. Germany is seeing important developments when it comes to the increase rate of people infected. That increase rate is actually going down, and it's basically the right direction that Germany wants to take that, but it is still not enough for Germany and German authorities to lift those restrictions to social interactions. And that's the reason why the government, the federal government, but also regional governments, announced that the restrictions that are currently in place will continue to be in place until the 19th of April at least.
Over here in Ghana, we're in day 3 of a 14-day restriction. Thomas, let's now talk about a repatriation program by the German government that brought people from around the world, Germans from around the world, back to Germany. Some of them including persons who were here in Ghana. What do we know about the sort of people that came in?
That's correct, Gifty. This is a very big program actually by the German government. The German government has earmarked for this repatriation program around 50 million euros. It has carried many flights so far from different parts of the world, trying to bring back German tourists that, because of all these worldwide restrictions to travel, are stranded in different parts of the world. So around 150,000 to 170,000 German tourists have already been able to return to Germany with the help of the German government. But there are still particular pockets, countries where this is becoming more difficult. I'll give you one concrete example. New Zealand. There was one flight from New Zealand with German tourists, but afterwards New Zealand imposed restrictions which are making it more difficult for Germans to actually get to the airports, for them to be able to transport it back to Germany. So basically all flights from New Zealand have been stopped for now, and this just gives you one example of how difficult this is. You mentioned correctly that there was also a flight from Ghana, German tourists in Ghana, and all this has to do with the fact that German authorities have told Germans to stop traveling. They have told Germans to stay at home. They have issued a global travel warning, and as such, all Germans who are abroad, who do not live abroad but who live in Germany but were, for example, simply abroad as work and travel, or who were abroad as exchange students or simply tourists, have been asked to return. And the German government has put this program in place to try and help them to come back and avoid them being stranded in those respective countries and carrying with all the costs that involves, having to pay hotels for weeks, or even try and find out that there are no flights back to Europe on time.
Well, I'm sure that none of those who were repatriated from Ghana has COVID-19. Hopefully they've all been tested. But let's talk about the health system in Germany. Germany is one of the wealthiest countries in the world, but we've seen how the entire world is reeling under this COVID-19, how the United States as well, China, are all suffering from this. Tell us about the German health system and how it is supporting COVID-19. What can we learn from such a system?
Gifty, the German health system is considered one of the most advanced in the world, but it is very important to say that this pandemic is also revealing its weaknesses. There are reports of staff shortages, of equipment shortages. There are reports of unnecessary bureaucracy. There are reports of lacking digitalization, of doctors needing to improvise more and more because they do not have the necessary equipment or the necessary staff to carry out all the different activities that they have to carry out now, specifically when you have so many people wanting to have access to that healthcare system. And that's why, on the one hand, the German government has passed 2 packages to try and expedite these kinds of reactions, to try and help hospitals that might be particularly affected. And at the same time, for example, the city of Berlin has announced that it intends to build a new hospital to house around 500 or 500 to 1,000 patients. At the same time, Gifty, it's important to stress that Germany does have more intensive care beds per 100,000 inhabitants than other countries in Europe, and that has allowed the German government to, for example, offer a helping hand to countries that are more affected by this, like France or like Italy. And that's why some patients from France or from Italy have been brought to Germany to have their coronavirus treatment here in this country, because Germany has the space available at the moment. So basically, the goal that the German authorities have, and that's, by the way, a goal that other governments around the world have, is to so-called flatten the curve. In other words, to make sure that the healthcare system is not overloaded, that the healthcare system can cope with the number of people infected step by step and without being overwhelmed.
Well, Thomas, I'm going to take a very final word from you. Hopefully we won't have to get there. Here in Ghana, we're just about getting around 190 cases. There are about 5 people have died, but I dare say that our health system has not yet been as overwhelmed, but still we celebrate those at the front lines, and I believe that in Germany as well. Let me take your final words. And how do those at the front lines react to some of these pressures that they're having to soak in?
Gifty, this is particularly important, and that's why I think the project that you have, that idea of speaking directly to those on the front lines, or thanking them for their work, is so important, not only in Ghana but also in other parts of the world. Germany has also joined in thanking, for example, healthcare workers, but not only healthcare workers, for example, also those who have to work in these very difficult times. For example, those who work at a supermarket, those who work at a pharmacy, who work non-stop to try and offer help to other people. And this is something that we've seen also in other parts of Europe as well. In Italy and Spain in particular, there are moments during the day where you can hear people clapping to honor those that are working to try and take care of others who are affected by this situation. So I think it's very important, Gifty, in these very difficult times, to also try and take a moment to thank those people who are particularly vested in trying to make sure that everyone is healthy or remains healthy, and try and find the positives also in this, because it's not only about people dying and people getting sick, but it's also a moment to try and reflect and try and understand that there are very positive elements in society as well, and that if we all work together, if we all collaborate, then we will all be able to try and, well, at least we'll become better persons after this crisis ends. So it's not only, again, about those very difficult moments and difficult situations, it's also trying to find those very special moments that can also be found. And one of those special moments that I've been able to find personally are those sentiments of gratitude towards, for example, health workers,
right,
or other people who are working non-stop to help others during these very difficult times.
That's true, and we'll take some time as we go along the days to celebrate all of those people. Do not call our line; it's just for WhatsApp messages. We'll take some time to celebrate all those people. And Thomas, we'll look forward to getting some of those videos of appreciation, for example, from Germany or other parts of Europe, so we can share it with the rest of Ghana and see what we can learn from that. Thomas, thank you. Thomas Bauer is political correspondent with our partners DW, joining us all the way from Berlin. I'm going to take you to South Africa, but like I said, do not call my line, please. This is just for WhatsApp. It is not for phone calls, so do not disturb everybody else by calling. I'm going to take you to South Africa right now. Like I said, here on the Pulse, we give you everything coronavirus where you don't get on any channel at all. It's a world tour. In South Africa, it's Duduzile Ramela. She's a freelance journalist. We're so grateful. Ma'am, thank you so much for your time this afternoon. What is the latest in South Africa? All right, we're trying to get Duduzile Ramela there. You saw her. Trying to get her so we can get through to speak to her right now. But if you do have any video, like I said, you can just record yourself saying thank you to the frontline workers. And I'll have a frontline worker here in the studio subsequently. So we'll talk about, when we even say frontline workers, who are they? Who can we put in that line so that we can channel our appreciation appropriately? Is it just everybody within the health sector? Is it about the security service agents who are out there making sure that you stay at home, enforcing the lockdown, so to speak, so that the disease doesn't spread? Is it about that watch seller who is still exchanging money or taking your money, the risk that she's exposed to, taking those monies, etc.? Is it about us as journalists who go out there talking to people with our microphones? Who do we put on that list to be celebrated? But by the way, I celebrate you that you're at home, that you're taking time to stop the spread. Let's go to South Africa. Duduzile Ramela is joining us from there. Hello, Ramela, can you hear me?
A very good evening to you.
Right, thank you. I was just asking for you to give us an update on the South African situation.
Sure. As of yesterday, the health ministry coming out to give us figures. So they announced that 1,153 people are positive with coronavirus and reporting, unfortunately, 5 deaths, 5 too many. The lockdown is day 6 in South Africa. We're still restricted in terms of movement. Shops open very early, they close early. Alcohol is still not on sale. Cigarettes are still not on sale. Only essential service workers are allowed to go to work, and also with that you need interesting developments today is that the transport, the majority of South African taxis, I think it's in Ghana, so something similar, like in a taxi you find a lot of inside the taxi, something like 15 people inside the taxi. So restriction that you only take in 70 in terms of.
I'm struggling to hear you, Duduzile. I don't know if we'll have to try and reconnect maybe via phone so we can hear you clearly, if that's going to work properly. Perhaps we'll try and do that because Skype isn't working smoothly as we had expected. But Duduzile is a freelance journalist in South Africa. We're going to try and raise her on the telephone, hopefully, so you get that update. But what she was saying is that South Africa is still in lockdown. They were in lockdown for 21 days. We're supposed to be in lockdown for 21 days. We here are doing it for 14 days. They were 21 days. That started about last week, Thursday. They're still in it. She says that you still need a permit to go out there. She's talking about the need, even if you have the need to buy a cigarette, you need permits to be able to do that. She was talking about the taxi situation, and of course it wasn't so smooth, so I couldn't really hear her what she was saying on that. But you know the situation here in Ghana, taxis are allowed to move, but you cannot take too many people in that taxi. Even if it's an Uber, you're allowed to take about, I think, 1 or 2 people on Uber. We want to see what the South African situation is when Duduzile Ramela joins us again on the mobile phone. I'm going to take you back to South Africa, where Duduzile Ramela is standing by. We've been trying to hook up with her to find out the South African situation, always learning from one another as countries that are all affected. Duduzile, thank you for your patience, really. You were telling us about the South African situation. Please go ahead.
Where we lost each other, but maybe I'll just start from the beginning.
Yeah.
So 1,353 cases with 5 deaths. Unfortunately, those are numbers from the Department of Health coming out yesterday. We're still on day 6 of the national lockdown. By and large, you know, in suburban areas, people very much adhering to the restrictions of no movement, not even, you know, walking your dog, but people able to go and buy food and essentials. In our townships, however, the situation is very different. So on Monday and Tuesday, we saw a situation where it was time for grant payments, and so the elderly in South Africa and the disabled and others, the categories of grant payments received their grants. But we saw long queues. There was no social distancing. People weren't wearing masks. but they needed to get their money. An interesting development today in terms of transport, the Transport Ministry coming out, they had imposed rules to say, or regulations rather, to say that there will be no public transport, right? But today they came out to say that there will be public transport, but from certain hours. So from 5 a.m. until 10 a.m., taxis will be allowed to operate. Between 10 a.m. and 4 p.m., they're not allowed to operate. They resume again their operations from 4 p.m. to 9 p.m. So that extension being given of an hour. A majority of South Africans using public transport. And so there's been quite a bit of a difficult situation, because yesterday taxi drivers or taxi associations were threatening a strike, saying this is our daily bread. How are we then supposed to live? But by and large, day 6 of the national lockdown, I think South Africa, we're not there yet. The message is probably slowly but surely seeping in, but we're not there yet.
Interesting. Here in Ghana, public transport is allowed, but they are expected to observe social distancing. Are the public transport in South Africa allowed to take the normal, usual number of people that a vehicle is able to contain, or are there restrictions on that as well?
So there are restrictions. So you'll find that, for instance, in a taxi that can take, something like 14 passengers, now they're expected to take only 70% of that, and also under strict rules that they should be giving passengers masks, and they should be giving them sanitizers. Government has made a commitment that they will give the taxi drivers the necessary sanitizers and the necessary masks that they need. Also emphasizing the transport minister today to citizens that, you need to take this upon yourself to protect yourself. Do not enter into a taxi if there are no masks for you to wear. I don't know about you, but I grew up on public transport. I grew up in a taxi, and it's quite impossible to even open a window for air without somebody saying, hey, I'm cold. So to see how this is going to be rolled out will be very interesting. I say that because on the issue of, the lockdown, it's not everywhere that we see police presence or military presence in terms of blocking off roads to say, who are you, where are you going? So I think the implementation of this lockdown, the implementation of all of these measures that they're bringing in is going to be very critical in us turning the tide where this is concerned.
Interesting developments there. Well, one of the things that have come up here, that has come up here in Ghana, is that people are complaining that the security agency officials who are enforcing the lockdown are physically abusing some people. Is this a story that we can tell for South Africa as well?
Sure. We had a police officer who was arrested for shooting people who were congregated last week. We were reporting on that on Monday. And also we have had incidents of people complaining to say that, the police are a little bit heavy-handed. And it's in contrast to what the president had said when he said that he is deploying the military to be out on the streets. He said this is not for you to exercise a heavy hand on citizens, but it is for you to make sure that you help the citizens understand. But the reaction to that, to be honest with you, is that, there's two schools of thought on that. The one school of thought says that, well, what do you want, really? Do you want us to turn the tide? Do you want us to really, not get to a situation where we are like Italy? Because our healthcare systems cannot take the burden that, if the world trends are anything to go by, that will count for us. We have an issue of ventilators. Do we produce our own ventilators, or do we import ventilators? You find mostly that we import ventilators. And the other school of thought says, well, you can't be too heavy-handed. Just make people understand. So there's been a catch-22 where that is concerned, but we have been receiving some reports of heavy-handedness.
Right. Let's wrap up, Tujuzile, with your very final words. If there's anything else we ought to know before we talk to you next time.
I think it's not just a South Africa situation. I think it's a continental situation. Yeah. I think what coronavirus has done, and I speak as an African and not as a journalist, is that it has really brought to the fore the things that we should have done a long time ago as a people to give dignity and quality of life for the average African citizen. speaking of the production of ventilators, that's something that we should be producing right here at home. So I think that, you know, in the midst of this and even after this, once we come out on the other side, we really need to take a hard look at ourselves as a continent and do better for our people.
Well, next time we talk to you, we'll be looking at how frontline workers are being celebrated there. Here on the show, we're dedicating a segment to celebrating people who come directly in contact with people in these times. So hopefully we'll get some stories there from South Africa.
Absolutely. Thank you.
Thank you. Duduzile Ramela is a freelance journalist with South Africa, giving us an update. Well, it sounds pretty similar to what we're experiencing here, except they are looking at much more days, 21 days, when we're looking at 14 days. South Africa is already in day 6, she said, and the taxis, they are allowed to work within a period of time, so they're not allowed to work throughout. It's allowed to work from 5 a.m. to 10 a.m. and then from 4 p.m. to 9 p.m., she said, because South Africans like us rely heavily on public transport. Well, the story seems the same. We're going to take a look at the global picture. What's happening? Let's take a look at our charts. Well, so that is Johns Hopkins updated website. It's updated constantly. We're going to take a look at any of these countries that there is. Let's start perhaps with the United States of America. It looks like the United States of America has overtaken China on that list there. In the US, we're looking at 4,102 deaths. That's quite a lot, because so far 190,089 people have cases have been recorded. Out of that 4,000, 7,141 have died. Bear in mind that the United States is also in a moment where usually they'll have flu, they'll be dealing with flu. And so 7,000 people, 7,141 people have recovered, 4,102. That's the United States situation. Italy, one of the hardest hit countries so far, with their health system reeling under this coronavirus. Let's take a look at what's there. 105,792 cases there so far. 12,428 people have killed. Now, Italy is one of those countries that have recorded 900 deaths in one day. Now that is absolutely critical. 15,000, by the way, 729 have recovered in Italy. Let's say a prayer for Italy as we pray for ourselves. Spain is another country. Now it looks as though they're arranging it according to the countries with the severest cases. So from the United States, Italy, Spain. Take a look at Spain. 102,136 cases, and the total number of people who have died, 9,053. Now these are figures, but these are human beings as well. Thankfully, 22,647 people have been declared recovered. Bear in mind as well again that even after you have recovered, we're seeing reports that there is still the chance for you to be reinfected. China, where it all started, 82,361. We've seen the numbers declining favorably for China. 3,316 people have so far died. 76,000 people plus 405 have recovered in China. We've already spoken to you about Germany. Let's move on quickly to look at some countries perhaps in Africa. But yeah, if you do log on to the Johns Hopkins website, you can get all of those updates there. Let's take a look at what's happening in other African countries right now, shall we? Okay, so let's take a look at Burkina Faso. You know that we share a border with Burkina. We share borders actually with Burkina Faso. 261 cases. They're slightly above us, but yeah, we are at 190. We seem to be following. Burkina Faso has 14 people dying. Some in top official positions as well, government positions as well. 32 people have so far recovered, which is not so bad. A good thing there as well. What's happening in Senegal? In Senegal, 190 confirmed cases, so we're almost in the same league with Senegal, except that we have 5 deaths. Senegal has 1 death, and 45. A lot more people have recovered in Senegal. Let's see, the final country, Cote d'Ivoire. What's happening? Well, we'll come back and do Nigeria as well, but let's take a look at Cote d'Ivoire. In Cote d'Ivoire, they've recorded 179 cases. 1 person has died, 7 people have recovered. That's the story in Ivory Coast. And finally, let's take a look at our neighbors, Nigeria. We do know that We trade a lot. We actually live with Nigeria. 151 cases so far. 2 people have died. 9 people were told have recovered so far.